Surgeons/doctors of Reddit, what's the dumbest thing patients have lied about? Do you smoke cigarettes? No, I quit. When did you quit? This morning. Quitting's easy, I've done it 1,000 times. Quitting isn't the hardest, the real hard part is resisting temptation a year later, when life is hard and you are drunk, and it seems like something minor. I don't know, you have to completely change your mindset, that you can smoke any again. If you get truly addicted like I was, they aren't that hard to quit. They are hard to truly and completely quit as they always around, and a single slip up puts you back where you started. But at least with knowledge, you can quit, and life is actually good without them too. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes, and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy, asked if solids consumed in 24 hours prior, patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon, and cannot continue. Patient specifically instructed not to consume corn beforehand, as this happened prior visit. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room, and it smells like a cigar den, I know they smoke. But they'll tell me they don't, right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often, it'll turn out positive, and suddenly surprised Pikachu face. Edit, lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons, so they don't rush into surgeries that end poorly. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself, by accident, while holding a gun. Still, don't know how he didn't fracture anything. Penis modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis, and it was split/bifurcated with multiple piercings, to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected, with a possible abscess. Cancelled case, called urology consult for infection/abscess evaluation. I fell down onto my couch, and a cucumber was sticking up between the cushions. It went right in. Edit, I can't believe my top comment on Reddit is about shitty excuses and rectal surgery. Edit 2, thank you kind Redditors, but shitty patient excuses for rectal obstructions don't deserve Reddit awards. Too funny. 1. Patient says to me, I was outside gardening, while naked, and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter, and forgot it was there. Then, I walked into it. 3. Me, have you had anything to eat or drink today prior to your surgery? Patient, no, with a half-eaten candy bar in front of them. Me, are you sure? Because if you have, you could vomit upon going to sleep, and it could enter your lungs, causing you to die. Patient, then yes I have, I had half that candy bar. 4. This one guy, repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. 5. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli, some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, they did that last time, I didn't like it. Do you have any medical problems? No. So, no diabetes? No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. There's a former ER nurse, in TikTok, that does skits about his former career, and he recently did one, where a patient was adamant he didn't have any problems with his blood pressure. Because he takes his blood pressure pills. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications, when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone, in a tender and respectable way, saying how really grateful for our work he was, and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly. And after we did so many changes with his medication, in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt, before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also, obviously, discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out, he suffered a lot from loneliness, and he was an old man that didn't have much contact with his family anymore, but mostly, because his family didn't reach out to him almost at any given time, even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients, to appear lying about their symptoms, only trying to gather some attention at a private minute to speak about anything else. Most of the time, they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Their age. Had a woman say she's 30, when she clearly didn't look it. Oh well, I move on to other questions. Look at her files, and lab reports, have her real age on them. 41. Like why though? What difference does it make, lying to healthcare staff? This is health related, not your Tinder profile. Nobody gonna see this and go, I ain't dating an old lady. By the way, she was married with children. I had a lady tell me, she had no idea how she got a rash she had on her face. I left the room, gave a report to the MD, and when I walked back in, with the doctor, she looked at me and said, I didn't think you'd be coming back in the room, and then proceeded to confess that she'd been cheating on her husband, and thought she had herpes. She did not have herpes. It's not so much a patient lie, as it is me, being dumb, inexperienced, and uncomfortable, asking necessary questions. I had a hypothetical patient, during residency, that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer, so I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic, and I had been yelled at by patients previously for asking, do you have sex with men, women, or both? It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. Woman comes to emergency with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in her vagina. Is there something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange, peel still on. Oh, that. We heard it would improve her fertility. You can't make this shit up. I had a guy insist that someone else put cocaine and heroin in his urine. Even after I tried to move on with the conversation. Had someone say that their roommate used a spoon when cooking meth, and then he ate cereal with that spoon later, and that's why his piss popped hot for amphetamines. We have a favorite story about a colleague who failed a random drug test. Turns out, he was at a party where other people were doing drugs, not him, but he put his sandwich down on a table at one point. One of my favorite things I wrote, my first year out of medical school. Please note, patient has stated multiple times that he wants to leave and would leave AMA, against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first, and if he tolerated it well, would transition to regular foods. However, PT ordered Chinese food delivery instead. Then, patient was complaining of a headache, was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Patient: I haven't drank alcohol in months. Patient's family: it's true, I've been with her the whole time. Me: ma'am, your alcohol level is 325. Patient: impossible. I would never lie to you. My instructor shared a story once of a patient that kept insisting she never drank alcohol. It turned out, she didn't consider wine to be alcohol, because it was served in church. Only distilled spirits and beer were alcohol, so her 2 bottles of wine a day didn't count. Know of someone who had their entire family lie about having stopped drinking. Imagine the transplant team's surprise when he went through DTs while in the recovery room post-op. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse: patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure, and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain, and he asks for intravenous narcotics, Dilaudid. I tell him no, because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital, after I refused the IV narcotics. Also, the MRI was normal. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts. From light bulbs to hairbrushes, to a golf shoe. And at first it's hilarious. Then after a year or so, it's not funny, because you've seen way too many distended buttholes. Then after a decade or so, it starts to get funny again. Because you think you've seen everything, and then one day, a 45-year-old man is driven to the hospital by his wife, and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing and he slipped in the locker room, and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Nurse here. The absolute dumbest thing patients have said, and to be fair, this was the patient's parents, since I was in petty, but still dumb AF, and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby, and called the next one in by last name. They stand up, and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies, and go out and let the pediatrician know they are ready. The pediatrician goes into the room, and come out like 3 minutes later and says, "That's not my patient, where is my patient?" I'm like, WTF? I go in and ask the parents and know in fact they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart, and had to get legal involved, to make sure there were no HIPAA violations, which fortunately, there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know. Like, how does that even play out in their minds? Since you included surgeons, I'm expecting someone to pop in and talk about all the patients who lie about the no eating 12 hours rule, or are unclear on the details. Had gastric sleeve surgery several years ago. 2 weeks before surgery, you start a liquid diet to shrink your liver, or the fat around your liver, and make surgery easier, also, makes recovery easier. Psychologist shared that one patient had food in their stomach when the surgery was started. So, not only did they not do the liquid diet, they also ate 12 hours before surgery. This was part of our discussion of how they decide who is ready for surgery. They all felt this patient was ready, was compliant, etc. And day of surgery totally blew it. The surgeon stopped the procedure on this patient, and closed up. I was shook. It was such a journey to get to surgery, it would have been devastating. First baby, never pregnant before. New OB appointment, we collect everything and do exam. I put a speculum in, and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner know that she's a single mom. Not dumb, but just very obvious on an exam, that she has definitely given birth before. I left a note on her chart, to not mention prior pregnancy, in front of her new partner. Another, on my gen surgery rotation, as a medical student, removing objects from rectums, due to unfortunate falls. I had a patient that lied about having a job. I asked, because he had hepatitis A, and I wanted to know if he needed a medical leave. He denied it even though I asked twice. Next day, he came back, because he was going to get fired if he didn't provide a doctor's note. ETA, some clarification. 1. I'm in Venezuela, he wouldn't have had to pay anything for that visit, regardless of his employment status. 2. He isn't an undocumented immigrant. It's a very small community, where everyone knows each other, and he has lived there his whole life and many of his relatives have also been my patients. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. 3. He said that he didn't have a job, he didn't say that he didn't need a medical. 4. I asked what he did for work in his second visit, but I can't remember what he told me. 5. There really isn't a whole lot of stigma around HEPA around here, even if you work handling food. People just sort of feel sorry for the person and tell them to not eat yellow things. So, I don't think it was because he was afraid of being shamed/reprimanded because of it, but I could be wrong. 6. I'm obligated to report viral hepatitis cases to the health ministry, so they make sure there isn't an outbreak, and I told him this. So, he knew that it was going to be reported either way. Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie, since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient, at an inpatient psychiatric facility, for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out, she had an ultrasound done a week before, that found only normal breast tissue without masses. However, apparently, this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. So, the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Dad is a physician, and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER, with a towel over his groin, covered in blood. Claimed he was cutting vegetables in his kitchen, and the knife slipped. Dad takes a look, and the guy is butchered down there. Had to call a urologist, in the middle of the night, to consult. Guy eventually confesses to trying to give himself a circumcision, because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency penis surgery. I'm just a med student, but a doctor shared this with us. She's a gynecologist, and this woman came to her, complaining about how she hasn't gotten her periods in few months, and well, she was showing menopausal symptoms and in fact she looked almost 50, but she kept saying she's only 30, and she can't have menopause. It has a funny ending, when the doctor asked if the woman had a kid, and she said, yes, he's 27 years old. I don't know why people lie about their age, but this was a funny story for the whole class. The worst I've heard was from the ED. Common question before shooting a X-ray is, how'd it happen? Because I may have to use an optional position or something. From women, I tripped on the rug, I dropped a heavy box on my hand/foot, it was dark and I didn't see that the door was open. There's always a social worker in the ED, and we'd take her to imaging, for better shots. Sometimes, radiologists would order a SNAT series. Suspected non-accidental trauma. Where there's one break, There's always a history of more. I work in ophthalmology. I see patients, nearly every week, that are faking vision loss. Most often, it's to try to get disability. Sometimes, it's just attention seeking, or extreme stress/anxiety. In rare cases, patients truly believe they cannot see, or have convinced themselves they cannot see, when all exam findings and testing are normal. It's called non-organic vision loss. Not a doctor, but in patient care, nonetheless. 1. Guy comes in, between 17 to 19 years old, for pebble hits penis. Pretty odd. He says, he was doing yard work, when the tool knocked a pebble into his penis, he went to check it, and now it was making pus. Nurse clarified, that he was wearing pants. Denies sexual history. He stands by, that he got hit on his penis by a rock through his pants, that made him produce pus. He had chlamydia. 2. Guy says he was forced to do meth, or something similar, at a store. Came in, because he thought he was dying. 3. A fun bonus, a frequent flyer comes in, for his stomach hurting from eating this chili he had. While continuing to eat said chili, in the lobby. Edit, I have a few funny other stories, that I'm just going to add for the fun of it. Woman comes in, after doing crack and states, now she feels sad. That's all we got. Older woman who OD'd on something, says, she thinks her son poisoned her, who she hasn't had contact with in years. Old man with various infections, but his pubic hair was green. We still do not know why. Guy came in for vomiting on Thanksgiving, because he ate too much but it was really tasty. No other complaints, and felt fine now. Addict left AMA, because he had to go to meth, right now. He was in for other issues but had to leave immediately to do more meth. He eventually came back for treatment, thankfully. Minor comes in for poisoning. Turns out, she had food in the microwave, sprayed said food in microwave with roach poisoning, then ate said food, and vomited. Now, comes into ER on Thursday, events happened Sunday, because she was having contractions. Added for clarity LOL, she was also 27 weeks pregnant. And eating roach poisoning. Anything, to be honest. I honestly don't care, what you do, or don't do. Usually if I'm asking, it's because, it matters for your healthcare, and if you lie about it all you're doing is, putting yourself in danger. As a more real example, I've had a post-transition transgender patient lie about the sex they were born with. I understand it's hard to deal with a lot of the medical community that can be judgmental, but this patient ended up having prostate cancer. Only found out, after we scanned them. Another one lied about having prior back surgery, before I was about to send them for an MRI. Did a physical exam and saw the scar. Asked again, and they just said, they didn't feel it was important, and didn't want me to assume it was related to previous surgery. They were there, for back and abdominal pain. Medical school student. Not a big deal, but a patient lied to me, about what she had eaten. She was obviously having some problem with her gallbladder. Typically, this pain can be caused by greasy food. So, I asked the patient what she had eaten before she got this pain. Patient said, she only ate a salad with very little ranch, that's it. I even explained how greasy food can cause this pain, but she's adamant, she only ate a salad. Anyways, I report back to my attending, and we see her together. The attending asked her what she ate. The patient said, salad, then adds, she also ate a burger. It wouldn't have changed the plan, but why lie? I recently had a patient double down, to the point of yelling, that I never told her to stop her aspirin, for a lung biopsy. During our clinic visit, she told me she didn't think she took it anymore, but I reiterated it multiple times, including asking her to check if she took a brand name and wrote it in my clinic note in 2 separate places that we discussed it. Sure enough, she arrives, and says yes, she takes it, and no one told her to hold it for 5 days. Yes ma'am we did. Well it's Monday, our clinic appointment was Friday, how would that make any sense that you told me? Ma'am the appointment was last Wednesday. Oh. I just don't remember. Just open with that, and we'll reschedule you, it's fine.